Welcome back. My next guests are plastic surgeons of Lexington, Dr. Joseph Hill, Dr. Michael Lynch, and Dr. Evan Moore. Thanks, guys, for coming in.
Yes, thank you.
Now, you do a lot of stuff and you make a lot of people pretty, but we're going to start at the top of the head and do the face because you've done a lot of facial work and it's not just one thing. Where do you start, Dr. Hill?
Well, if someone's coming in for facial rejuvenation, I typically like to start at, the forehead, brow area, work our way down, eyes, and then on into the face. It's typically how I kind of look at somebody.
Now, Dr. Lynch, you mentioned eyes. Do you do, it's called a blepharoplasty?
Correct, yeah, that would be the surgical term that we describe, and that involves different things whether you're doing the upper eyelids or the lower eyelids, and then with regards to that surgery, usually you're addressing some amount of skin excess in the eyelids, and then also some amount of additional periorbital fat, and to rejuvenate the eyelids with a blepharoplasty.
Now, Dr. Moore mentioned lower and upper lids, but sometimes there's a cosmetic reason, sometimes there's a medical reason also?
Yes, it's more for the upper eyelids, and that excess skin can cause, they can be heavy because your eyelid muscles aren't as strong, and so they can block some vision. And if you go see an ophthalmologist and do visual fields, you can get evaluated for potential getting an upper blepharoplasty covered by insurance. Okay. But lower blephs are typically not covered by insurance.
Okay. Now, Dr. Hill, you mentioned forehead. Mm-hmm. Do you do surgery on the forehead, or there are non-medical or non-surgical treatments cosmetically?
Yeah, there are. Botox in particular, or Dysport, there's a couple other neuromodulators out there. Depending on how you inject it into the forehead can raise the eyebrow, and an eyebrow that's lowered or ptotic, so that's what we say, can block your vision, and so putting a neuromodulator in the forehead can elevate the brow and potentially help you see better. Typically, though, that's for cosmetic purposes, not necessarily, and insurance wouldn't cover that.
Well, I got to give you a shout out too, because you did operate on one of my family members who had a very large skin cancer, and you did a great job, and you can't even tell. So I'm assuming you do some of that too.
Yes, skin cancer work. Yes, we see quite a bit of skin lesions, skin cancer, things of that nature. Sometimes the dermatologists refer, sometimes patients self-refer.
Well, yeah, you did a great job.
Well, thank you.
You did a great job. Now let's work our way down.
Sure.
Nose.
Yes.
What do you do to the nose?
Depends on what the person wants is how we usually kind of go about it. I mean, I think there's different aspects to what's referred to as rhinoplasty, depending upon what that person's cosmetic goals are for their nose, whether that's a prominent hump in the nose or tip refinement to kind of get where a person wants, or kind of the main things you look at when you're evaluating a nose and trying to determine what surgical pathway to follow.
It's interesting you said what the patient wants, because I guess beauty truly is in the eye of the beholder, and you really want to do what they want.
So I think it's extremely important, and it's probably the most important, in my opinion, when you're evaluating someone's nose. I think the nose is kind of the centerpiece of how you address some people and talk to them, along with their eyes. And so if you change someone's nose more than they want, I think you can create a problem that is not desirable. So that's why, at least in my opinion, I know my partners are the same way, you look at and talk with the patient what they want to achieve with each surgery you do, and then you stick to that plan.
Great. Now, going on down, I guess chin, lips, Dr. Moore, you do that?
Yes. Lips, predominantly, you can do filler. Some people, particularly with massive weight loss, can have a lengthened lip, and we can do an upper lip lift, which is just a fancy term of cutting some excess skin to kind of elevate the lip. Chin, you can do chin implants as well, in terms of modifications that we do. And that just all, again, varies with, talking to the patient and what they want.
All right, Dr. Hill, let's just talk about facelift in general. Mm-hmm. Is that different from what all we just talked about here?
It is. It's, as we age, we gain extra skin. Typically how I describe it is when we're youthful, we're like an egg on its point, and then as we age, we're kind of an egg on its larger round base. And we gain weight in our kind of jowl area and our neck, and so part of the procedure is to remove excess skin, and part of the procedure is to revolumize the face. And we revolumize the face by working with the tissues under the skin, and also sometimes we'll add some fat graft to the face in key areas.
Well, that's great information. You guys do great work. Thank you for what you do, and we appreciate you coming in.
Thank you.
Yeah.
Thanks for having us.
Yeah.